Each year, 15 million people between the ages of 30 and 69 die from non-communicable diseases. Over 80% of these premature deaths occur in low and middle-income countries. Researchers also show that cardiovascular diseases such as stroke, heart failure, high blood pressure, hypertension, and cardiac arrest account for most non-communicable diseases deaths. However, healthcare providers in Nigeria have raised concern over increased occurrence of non-communicable diseases in the country. On this week's episode of Core Health, we will look at risk factors of these diseases, the socio-economic impacts, efforts of government to reducing the healthcare costs, and what experts are saying about living a healthy life. Hello and welcome. I am Ibirunke Aroshala. Stay with us. Non-communicable diseases, also known as chronic diseases, are not contagious and therefore cannot be spread from person to person within a community. They are not caused by germs or parasites, but instead are triggered by genetic, physiological, environmental, and behavioral factors. The main types of non-communicable diseases are cardiovascular diseases such as heart attacks and stroke, cancers, chronic respiratory diseases, kidney failure, diabetes, amongst others. Experts say these diseases are associated with older age groups. Research also shows that 15 million of all deaths attributed to non-communicable diseases occur between the ages of 30 and 69 years. Risk factors as indicated by experts include medications, genetic predispositions, family history, and sedentary lifestyle. However, these diseases, according to healthcare providers, can be prevented if detected early, as prevention, they say, is better than cure.
Government needs to do so many things. Number one, in terms of awareness, government needs to create more awareness, go to the rural areas, even the urban city. We still have to do more awareness to people, go to the marketplaces, go to even the hospitals, schools. Let's, from our primary schools to the people, let them be aware. Let them be taught about all those diseases, cancers, and the rest. So I think that's one of those things that they can do.
Based on the fact that attention is given to communicable disease right now, does not mean that it is not possible it move the other direction. But I think we need to take into cognizance the fact that we're no longer doing our thing the way we should do it, like in the 70s or 80s. For example, most of the things we consume nowadays is, I'll say, we eat more of junk foods, canned foods, instead of us, going natural, eating the vegetable we all used to when we were still growing in the 80s or something. But I think at the same time, it's a general problem. It's a general problem in the sense that it's something that is cutting across the whole world. For example, people shipping turkey from Europe, from North America, and these are preserved foods. These are preserved foods. We actually don't know the kind of chemical used for the preservation of these things we consume, and this will eventually lead to what you just talked about, like cancer. Believe you me, until we have a serious control on the kind of importation.
The World Health Organization reveals that non-communicable diseases threaten progress towards the 2030 Agenda for Sustainable Development, which include a target of reducing premature death by 1/3 by 2030. However, living a healthy life with regular medical checkup, experts believe, can go a long way in curbing the increase of non-communicable diseases. If you're just joining us, our focus today is on non-communicable diseases. Healthcare providers in Nigeria have raised concern over increased occurrence of non-communicable diseases in the country. So what are the risk factors? What are the risk of contracting non-communicable diseases? These and many more are what we shall be looking at after this break. Stay tuned.
If you are not idle, nobody will probably come and encourage you to join their gang or the group.
Yes. To keep Nigeria one is a must that must be done. Nigeria is not going to break.
So if I want to buy this one now, how much you go sell this one?
I will free give you 500.
Sure, this one?
Yes.
This small banana?
Yes.
I know that Buhari can do it. He has a lot of plans.
We should be praying for him. He's a human being. Anything can happen to anybody.
The majority of the law they pass belongs to them, to favor them, not the masses in Nigeria.
If we want to change, let's change generally. Don't let's change up. Let's change generally.
The people giving voice to the voiceless.
Welcome back. Right now, we will be talking with the Cancer Control Coordinator of Lagos State Ministry of Health, Abosede Wellington, on why there is increased occurrence of non-communicable diseases, how they can be treated and prevented. We will be back in a jiffy.
Well, we are looking at non-communicable diseases. For the benefits of a layman out there, what are non-communicable diseases?
Okay, well, we can say that non-communicable diseases are basically diseases that are not easily transferable from one person to another. They're not airborne, they're not waterborne, and things like that. So, to be able to get them, it doesn't necessarily mean that you have to be in contact with somebody else to get infected with it, or you have to share something with someone else to be able to get infected with it.
So, what are the risk factors? Who is at the risk of contracting this non-communicable diseases?
Well, before now, in the health sphere, I would say that a lot of emphasis has always been on communicable diseases. We've always been so much bothered about taking care of all the polios and the measles and the choleras and things like that. But now with the new trend, there's increasing occurrence of non-communicable diseases. So we've had every day the increasing number of people that are affected by cancer, affected by hypertension, diabetes, respiratory diseases, cardiac diseases, and things like that. So basically, if you say risk factors, there's a lot that has to do with the global trend. We're talking about the lifestyle of a person. We're talking about genetic factors. We're talking about environmental factors. We're talking about diet. We're talking about drugs and medication and things like that. Those are basically, for different kinds of diseases, you have different risk factors basically, but these are the ones that seem to cut across all of them. Talking about a kind of lifestyle, if you have a kind of sedentary lifestyle, it's a tendency that you might have, a higher risk of having any of these non-communicable diseases. If you have a genetic predisposition, maybe you've had family history of it before, or you have a living relative that's had any of this, there's a higher incidence. You talk about things like smoking, things like taking alcohol, medication, maybe things like hormonal medication and things like that. Those are things that can predispose you to developing some of these non-communicable diseases.
Alright, so Ma, can you tell us the socio-economic impacts of the non-communicable diseases?
Statistics have shown that we have non-communicable diseases affecting a lot of the workforce. The age group, you talk about between ages of like 25 to like 55. That is majorly the workforce population of any nation. By the time you have this age group of people being affected by something that is chronic and lifelong, that is a lot. Besides the fact that it takes them away from performing their duties, it reduces their work hours. They have to take care of them, so they have to go to the hospital, seek help and things like that. At the same time, they have to spend money buying medication, going for treatment and things like that. Economically, it's depressing. Let me put it that way. in that they have to spend so much money that they would have spent on something else. So much money that even the government would have spent improving the economy. You have to spend on providing these healthcare services for people that have non-communicable diseases. This is a trend all over the world. I mean, if you look at even developed countries, look at America, look at Japan, look at the UK, the health spending increases every day, and it's because they spend so much trying to handle non-communicable diseases. Look at the US now, they're dealing with obesity, dealing with cardiac issues. It's a lot of money, it's a lot of strain on their health spending. So definitely the socio-economic impact that it has, it's devastating, let me put it that way. It definitely gives a big dent into the health spending, and it takes a large chunk out of it.
Detection, screening and treatment of non-communicable diseases have been identified to be the key components of the response to non-communicable diseases. What then is the role of government in reducing the health costs for these diseases?
The state government definitely does a lot, to take care of this issue. We do a lot of awareness, we do a lot of health education, we inform the public, we educate them, we empower them so they can make right decisions, so they can make informed decisions on how to even prevent this non-communicable disease, especially the kidney issues that you talk about. Now, another thing we do is we have our healthcare facilities. They're available, they're accessible. We have the primary healthcare facilities where you can go if you have early symptoms of any of these diseases. You can easily seek, they're very close by. We have them very accessible, they're in all our local government areas. And we have our general hospitals. They're available, they're there, they're affordable. You can walk in and you can get the services that you need. And we have the tertiary hospitals too. And besides that, of course, the state governments, we do advocacy regularly. We do several programs to support several organizations that assist in getting all this information to the public and things like that. And then we've had cases where the state government has had to support individuals in case of kidney transplant and things like that, even as far as taking people out of the country if the need arises. And then one other thing again is that the state government, we really recognize the fact that this is an area that we need to develop capacity in. We have a cardiac and renal center. Is located within the Bakada General Hospital premises. Is majorly to address issues that has to do with cardiac and renal. So all these kidney issues can be addressed there.
Why the attention on communicable disease? Why don't we have more attention?
I won't really say that government pays more attention to it. It just seems like government pays more attention because usually when there's an incidence of communicable disease, it's usually rapid and it can be very devastating and it's sudden. So it seems as if government pays more attention to communicable diseases, but actually we pay attention to communicable and non-communicable at the same time. Non-communicable diseases are diseases that basically they live with people. People live with them through this, for life. So look at what the government is doing now. We're doing a lot of advocacy, like we mentioned some time ago. There's a program that the state government is doing right now. It's called the State Wellness Week. Now, what we do basically is that we take the opportunity of this week to go to a particular local government, a particular senatorial district in the state, and a particular local government. And what we do basically is that we provide services for treatment, for screening, advocacy, health education on non-communicable diseases, and then we screen them for free and provide on-site treatments. And the ones that we can handle on-site, we refer them for further management. Now, this is done basically in one senatorial district, so we have about 15 or more local governments that benefit from the services. So during this time, there's a lot of advocacy, a lot of awareness that's being done on non-communicable diseases. And then besides the State Wellness Week, regularly we have a lot of organizations that come that seek support from the state government, talking about advocacy, sensitization, screening and things, and we support all of them. And then there's so many other things that we do. Okay, like some time ago we supported the Sickle Cell Foundation. There's going to be a bone marrow transplant site. There's going to be set up in the state. It's work in progress. The state government is supporting that. Besides that, we're talking about potential diabetes. We provide screening equipment and instruments, glucometer, blood pressure. We provide them in all our primary healthcare facilities, so anybody can walk in. You can check your blood pressure, check your blood sugar, and then some of the even cancer screening services, we provide them in our facilities, so you can walk in and get screened for these things. So it's government, there's emphasis on communicable and non-communicable at the same time.
Recently I found that cancer in children, there are cases of cancer in children. Can you elaborate?
Well, unfortunately, cancer is no respecter of person, age, or even finances, or even sex. It's no respecter of anybody at all. It can afflict anybody. So unfortunately, we do have children that have cancers. And we have quite a number that have cancers. It's just that one thing we're a bit deficient. We might not have very accurate statistics as to say there's a number of children that have cancers, but definitely if you go to our facilities, we're having a increasing number of children being brought to our health facilities. You know, there's a lot of reporting now. It's increasing by the day. Before, when we have a lot of this cancer, a lot of people keep them indoors. They try and stick traditional care and things like that, and then they take care of them indoors until some of them expire, and then they're just buried and like that. But now there's a lot of enlightenment, so people actually bring them to the facilities and seek medical care, and then when they come, we're able to take records of such people. Yes, there's an increasing number of reporting of children that have cancers.
What was the statistics?
I can't give you specifically this number. So this number are the numbers that we have. I can't give you specifically for now.
Okay.
But I know that there's an increasing trend, the number of children that have cancers. Now, we have them in our health facility. They're managed in our hospitals. Yes, we have them. The good thing about this is that some of these cancers, if you catch them pretty early, you can actually treat them. And they have very good prognosis. They have very good outcome. We're talking about cancers like Wilms tumor.
Okay.
That one, if you catch it very early, it has a very good prognosis. If you can treat
in children now.
exactly in children, yes, it affects the kidney. Now, that's one of the things that the government is very much interested in, and we're planning to roll out a program. What we're planning to do is basically screen children for Wilms tumor. We're going to provide these services in all our healthcare facilities, and then we screen these children, and then when we screen them, we catch them early, and then we can treat them. When we catch them that early and treat them, we have very good outcome at the end of the day. There are some of these cancers that can't be treatable. So the plan of the government is to screen them early, catch them early, and treat them early.
So can you tell us the risk factors of this cancer in children?
Okay, well, you know, like I said, some of the risk factors that we talked about the general, we talk about medication, genetic predisposition, family history, and things like that.
If you are just joining us, you're watching Core Health, and we are talking about non-communicable diseases. Before we bring you more facts about this, we will go on a short break. Don't go away.
Over 2,000 communities in Nigeria, each with its unique story. Some reel of comfort, most with its complaints. Whatever the story is from your community, we tell it. Let's journey together through streets, homes, markets, every nook and cranny to tell your story the right and the true way. Community Focus. It's all about you and your community.
Welcome back. To stay healthy, prevention is always better than cure. It is advisable to go for regular checkup and screening to know the state of your health. Let's hear more on this from Dr. Abosede Wellington.
Prevention is always better than cure. We want every Nigerian to be empowered. We want them to take the right decisions. We want them to take informed decisions about their health. We want them to go and screen themselves early. You should be able to take your blood pressure, check your blood glucose regularly. So if there is any kind of abnormality concern involved or discovered, it can be treated early. Cancer screening, go and screen yourself. If you're a man, you're over the age of 40, screen yourself. If you're a woman over the age of 40, screen yourself. screen yourself for breast cancer, screen yourself for cancer of the cervix. For a man, screen yourself for cancer of the prostate. If you have a family history, you've had a sibling or a parent that's had any kind of cancer, you should screen yourself regularly for that cancer, because once there's a family history, there's a higher risk of developing this cancer. Prevention is always better than cure, so screen yourself regularly, and then whatever you're advised to do, try and do the treatment early. Don't run away and go for what they call this something treatment. Take one kind of water, take one kind of diet or whatever. No. Go for treatment early. Once those things are caught early, they have better outcomes.
The major contributors to the risk for non-communicable diseases have been clearly recognized as tobacco and alcohol usage, sedentary lifestyle, poor eating habits associated with the consumption of foods containing excess fats, salt and sugar. Well, we have come to the end of today's program. Don't forget, your health comes first before any other thing. We'd like to hear from you on your observations, contributions and comments. And for sponsorship, kindly send us a text or call us on the number displayed on your screen. I remain your host, Ibirunke Aroshala. Bye for now.